The Bundeswehr offers help in many areas during the coronavirus crisis. For example, here in Doberlurg-Kirchhain, where Bundeswehr soldiers help Red Cross workers erect tents. At the Lausitz barracks site, there's a reception centre for refugees. The newly erected tents can be used to isolate those suspected of having coronavirus, a precautionary measure. A request for assistance was received from the Central Immigration Authorities of Brandenburg State. Officially, this support is called military assistance. But how does it come about? Military assistance can be requested through the federal or regional authorities, by cities, administrative districts, district governments and other authorities, or by state governments. The so-called district liaison teams, or rather regional liaison teams, assist crisis units by, for example, advising authorities and regional administrators. The regional liaison teams also gather any relevant information relating to their area and pass this on to their respective state command, of which there are 15 in total. The Territorial Task Command receives all situation reports. The Territorial Task Command Operations Centre is manned round the clock and, amongst other things, remains in constant contact with the Ministry of Defence, the Joint Support Service, the Bundeswehr Medical Service and the Federal Police Force. And, depending on the situation, also with the German Red Cross, the Federal Agency for Technical Relief, the Robert Koch Institute, as well as the Joint Information and Situation Centre of the federal government and federal states. When they receive a request for military assistance, the Operations Centre checks with the respective state command for available resources. Based on the information received and following a legal assessment, the commander of the Territorial Task Command ultimately decides whether military assistance is an option. If so, the appropriate army units are deployed.
The Territorial Tasks Command is designed for emergency management, typically forest fires or flooding. The current coronavirus crisis places completely different demands on our capabilities. While floods and forest fires tend to require helicopters, which we equip with sandbags or water tanks, in this case, medical support and extra pairs of hands are in demand. Anything the authorities or hospitals need in order to be able to cope with the coronavirus pandemic.
So in Neuwied, Bundeswehr paramedics support the Order of Malta Emergency Service and the German Red Cross in the construction of a so-called fever street. People are tested for coronavirus at this facility.
We are able to deploy troops very quickly. We currently have 15,000 soldiers in reserve. They usually serve in care facilities or public health offices, where troops are needed at speed to track chains of infection. And we stay in place until the civilian agencies can provide their own manpower.
The Bundeswehr will only assist in cases when civilian authorities are no longer able to cope. At the same time, the Bundeswehr also tries to anticipate where possible support services might be needed.
Essentially, we monitor the situation, so we are present at Germany's hotspots. We rely on information from the Robert Koch Institute, which is crucial for our discussions on how to focus our efforts locally, and so we can keep an eye on things and plan in advance on how to deploy our troops and bring them in when they are requested.
Intervening quickly to provide support from soldiers where it's needed. Civilian and military collaboration during the coronavirus crisis works.